sponsored by the Carpal Rx. When you're pregnant, you feel things happening to your body that you've never felt before. Unfortunately, one of those things may be hand pain and wrist pain. During pregnancy, such pain is often due to carpal tunnel syndrome. Carpal tunnel syndrome occurs because of hormonal fluctuations, which cause fluid accumulation, nerve hypersensitivity, and blood glucose spikes. All of these factors result in fluid retention, which is the root cause of carpal tunnel syndrome. To understand why this happens, we must understand what carpal tunnel syndrome is. It's actually a disease that affects an area inside the wrist known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like pregnancy, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective, it must solve the underlying reason for the swelling and not just temporarily relieve the pressure caused by the swelling. So what are the symptoms of carpal tunnel syndrome? The most common symptoms affect the hand and/or the fingers, especially the thumb, but not the little finger. These symptoms primarily include pain, numbness, and tingling. Also, these symptoms make it difficult to perform everyday tasks, especially when those tasks involve grasping and dexterity. Often, patients are awakened at night with the feeling that they need to shake out their numb fingers and hand. So what can be done to effectively treat this painful condition? Treating carpal tunnel syndrome should be done using two well-known and effective methods. The first is resting your hand in a splint, especially at night. The second method is to have deep tissue massage on your wrist and forearm. But this isn't your everyday massage. It requires specific motions on your wrist and forearm in order to drain excess fluid buildup from inside the carpal tunnel. It also serves to break up the adhesions around the tendons, which caused the inflammation and fluid buildup in the first place. But to be effective, it must be performed twice daily and for 2 to 4 weeks. But you don't have to visit a therapist every day to get this treatment because the Carpal Rx will do it for you. And you certainly don't have to suffer with hand pain while you're pregnant, nor do you have to wait until delivery for that hand pain to go away, if it actually does go away. The Carpal Rx always did and always will come with a true 100% guarantee. It also always comes with a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendonitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Learn more at carpalrx.com.